So our final speaker in this session, Denise Schmitz. She is from Charles Drew Health Center in Omaha. So if you would please help me welcome Denise.
Good afternoon, and I don't know if it's a blessing or a curse to go last, but I promise you I won't drag it out, and we will get out of here because some of us have to travel back home today. So I am the dietitian at Charles Drew Health Center, and when I started, I basically just was told to see patients, and there were a couple programs maybe to do, but I always see that there's a lot more that I could do, so I'm doing a lot of programs right now, as well as seeing every referred patient. I know. I need a clone or two, actually. So we are the first federally qualified health center in Nebraska, and we serve primarily the northeast part of Omaha, and we serve 90% of the homeless population of the state of Nebraska. We have, well, let me see. Our mission is dedicated to providing access to health care in a manner that acknowledges the dignity of the individual, the strength of the family, and the support of the community. And that's kind of what we've been talking about all day today. We have many services. We are a patient-centered medical home, and most of you know what that is. So we do try to be kind of a one-stop shop, but it's really nice where we are. We have everyone right there, so if I'm seeing a patient that needs behavioral health, I just have to push a button and I get someone in there to talk to them. So it's really quite convenient. We actually serve a lot of different ethnicities as well. We have interpreters that just hang out in the building all day. We serve over 20 languages, and one of our highest populations is the Karen language, and Karen, Karenni, Burmese, those are some of our top languages that we serve. Recently in North Omaha, and I don't have a slide for this, we have been developing in North Omaha. There's a huge redevelopment called 75 North. So it's not in the slides, but I encourage you all to maybe look it up. Where there used to be projects across the street from Charles Drew, now there is a huge development of apartments, coffee shop. We've never had a coffee shop that we could walk to. We can just walk across the street. Restaurants are moving in. There's a big aquaponics center that Susie Buffett funded. And there are just apartments and housing for all different income levels all over the place. So it doesn't even look like what it looked like 2 years ago. Let's see. This just shows our zip, because I'm going to, in the interest of time, I'm going to skim through some of these slides. Okay, this is the model we were told to focus on. And so in my job, I really focus on, I touch all of it in one way or another. Policy is probably the toughest, but in my job, I also report and I focus on the Healthy People 2020 goals of decreasing obesity with children and adults, as well as diabetes. Those are our two really big focuses. So that's with adults and with children. Let's see. My job is unique because I'm the dietitian, so I get referred by the physicians for people to see me. They also can refer them to my programs. We have put into our EMR system referral buttons for our Healthy Families program and for diabetes prevention. We've actually, every time we have a program that we think would make it just more streamlined, that's what we do. So I see the patient, they spend a lot of time with me more so than with the provider. So I find out a lot of information and I find out what their barriers are. Food insecurity is always a question I talk about. I want to find out if they're food insecure and give them the resources they need. But then also my programs, and not just my programs, but other community programs that may benefit them. Even maybe the YMCA has a financial assistance program. Maybe their family could get that so they could be more active. Because as we know, the neighborhoods are not safe, and a lot of our refugee families, they're really not comfortable walking much outside of where their home is. One thing I wanted to talk about was, before I talk about this, I hear the word non-compliant a lot from providers. Patients non-compliant, they're not taking their medicine, they're not losing weight, they're not lowering their A1C. And in my view, it's not that they're non-compliant, it's that what is making them be non-compliant? It's usually a lot of things outside of their own, they can't afford their medicine. They don't live in a safe neighborhood. There's always an answer to address these barriers and issues, and it's not really non-compliant. So I really don't like that word. So whenever I hear it, I just kind of roll my eyes and move on. So these are some of my programs that I do. Besides seeing patients directly and providing medical nutrition therapy, there is Cooking Matters, and I know it's in Missouri. You guys know what Cooking Matters is. Well, I brought them to Charles Drew because they were doing another program where they had to find funding, and the dietitian was responsible to do shopping, and I was like, oh, we could just do Cooking Matters. So Cooking Matters is a huge, wonderful partner, and they do for adults and children. We try to get the adult classes in once a quarter. And we do a few other programs, and I'm going to kind of go into them each individually. I'm going to skip over this part because I kind of talked about that. So these are pictures from, the first picture is our Cooking Matters for kids that we have at my garden program, which I will talk about later. The other picture is just my most recent graduating class of adults from my Cooking Matters class. And they were probably the most fun group I've ever had. I had trouble getting them to stop chatting so they could listen to the lesson. They were having a good time. And they always want to know, when's the next class? Can I come again? I'm like, oh, you have to wait a year, but that's okay. So Cooking Matters, we address a lot of, we address food insecurity, budgeting, shopping, reading labels, and really learning that it's okay to eat any food you want, except, how much or how often. I have type 1 diabetes, and I'm not afraid to tell anybody I can eat whatever I want. The 3 things we can't eat is poison people and people's pets. I saw that on Facebook. I thought it was great. I was like, it's just about, how much or how often, that's the thing. So food insecurity, again, is always an issue, and we always talk about ways to help them afford it more. We have a local farmer's market that comes directly across the street. Staff has to clear out of the parking lot at noon. So we have our farmer's market on site in the months of July and August. So every Wednesday, it's going to start next week. It will, or 2 weeks from now, I guess. We have the EBT cards. We have Cooking Matters that come to actually do grocery store tours, but at the farmer's market, a farmer's market tour to help people shop. And we also have the Big Garden who shows up, and they will also assist with different things and possibly even a food demo, but to show people how to select produce. Healthy Families, if I can get this thing to turn. Okay. Healthy Families is a program that's been in Omaha longer than I've been back. I actually was here in Kansas City for 13 years. I've been in Omaha 6 years again now. Healthy Families is a program that is by referral. It's in the Omaha community and in some other communities in Nebraska. It was started, CHI Health, or Allegiant Health at the time, started this program, and with partners provided training for the program, and they have done studies on the program. Basically, a provider will refer any child between the ages of 4 and 18 who is the 85th percentile or above BMI. At first it was 6 years, but we bugged them enough to change it to 4 because we were seeing all these little toddlers and we're like, oh, so we have to wait 2 years, We want to get them in as soon as possible. So it is an 8-week program. It involves physical activity. It involves transportation is provided by Charles Drew. If they need a ride, we used to give them bus passes, but people were using their bus passes and then not having transportation. So we decided we would just pick them up in our van. We have a van. We provide meals for them. Let's see. They're referred by the physician. I already said that. I'm sorry, I'm trying to get through this fast. Okay, so the format of the class is family activity time. So once they get there, everybody exercises. They have a meal together, which is prepared by me and my helper, and we use Cooking Matters recipes for that. We give nutrition lessons, or we have a behavioral health therapist that also is a part of the team. So we're talking about working together as a family. So at the end, when we say who's responsible for being active and eating healthy, the answer isn't mom or dad, it's everybody. We all are. We want them to get into the habit of realizing that we work together as a family, we're active together, we plan our meals together, we set family goals together. These are pictures of some of the activities. The first one's my favorite, but this is my Karenni class that I just had several weeks ago, and they were doing yoga. And we have a physical activity specialist from the YMCA who leads all of the activities. And then the other picture is we have this big plot of land right next to our building that we own that we can go out, and we've actually tracked how many miles it is so we can walk or jump rope, whatever we need to do if it's not too hot. This was just a couple weeks ago at our grocery store tour with our Corinne families, and they were probably the most engaging group I've had in a long time. Every family showed up for the tour. We got stuck in different sections of the store because they had so many questions about, what is the right milk to eat or to drink. And I think there we were talking about if we do have pizza, what else can we have to make it a healthier meal altogether? So we offer the class 3 times a year. We're given the money through CHI Health. They actually provide the funding. You have to apply for it. However, federally qualified health centers get the money no matter what. So us, One World, All Care, and Council Bluffs, we all get the funding for this. At the end of the 8 weeks, they get a certificate, and they also get a $50 gift card to shop at the grocery store that we did the tour at. So we're hoping that, especially for some of our refugee populations, a lot of them, some of them shop in the regular grocery stores and some don't, but we want them, just to expose them to that store and to show them how to shop healthy. One of our store tour guides actually was trying to show them how to read labels when it was our Karenni families, and the moms started laughing, and I knew what they were laughing at. They can't read English, so she was showing them, and they're like, we don't read English. So we try to focus on just a couple things that they might recognize. All right. There was a study done, and it is in the Journal of Community Health Nursing, and when you get your slides, it'll be on the link, and I've attached that so you can actually see more of the outcomes as far as like how all of the sites that they've done this at. The next program is just real quick at Charles Drew. This is our 6th year for doing the Earn a Bike program. This program started, well, I guess it's our 7th year. It started 7 years ago with just 50 refurbished bikes. Get the kids to do 4 hours of community service, write about it, talk about why, they want a bike to be healthy, and then they show up and they do a program, and they get their bike and helmet and lock and get to go home. Well, Children's Hospital in Omaha actually gave Charles Drew a $25,000 2-year grant to address childhood obesity a few years ago, so we were able to provide 200 bikes. And that was really exciting, and that was one of those times. That was just one of 3 different sessions we had that day. We have the Earn a Bike program that they have to attend on site. Parents have to come, and it involves, children ages 8 to 15 are eligible to apply. They have to do their 4 hours of community service hours, and they come in and actually get measured when they turn in their application, so we get the right bike sizes ordered. And then anyone who gets accepted gets a letter, and then they get told which time to come to the event. It's quite an ordeal, and I have to miss it this year, which I don't know. It's very exhausting, but it's really fun to see all those bikes and to see all the kids and how excited they are. They do, let's see. Why isn't this thing going? There we go. Okay, we do a bike safety station where they learn about, or a bike safety and helmet fitting. This is the Fix-It station. We actually were given a Fix-It station from Live Well Omaha at Charles Drew. We're a bike-friendly destination. So we have bike wrecks, and we have our Fix-It station. So the kids and the parents will learn a little bit about maybe repairing a bike tire. They learn about bike safety, and they get their helmets fitted properly. They even say at the end, they have to say, I promise to obey the laws and wear my helmet, and it's kind of cool. So they're very excited. We also involve the Omaha Police, and they talk about taking a picture of your bike, getting the serial number, keeping it in a safe place. Don't just leave it in the front yard by the tree. And they even shared stories about when they were kids and got their bikes stolen, so they kind of related to them. And then that's me and our wellness coordinator, Pam. We also teach fitness and nutrition, and we focus on getting more fruits and vegetables, and we give them information on summer lunch programs if it's early enough in the year so they know where to go to get food. And we always have to do Zumba, because that's Pam's thing. So this is what I started there. When I started at Charles Drew, I was told I was in charge of this little plot of a mess of a garden. And I went, what? And because I worked for Extension for 8 years, I'm like, well, what do you feel about beds? And so I actually, people talk about how do you get money, how do you get things? I just call people and ask, and if they say no, they say no. I call somebody else. Well, Lowe's donated enough lumber, and they delivered it and gave me everything I needed for the first 6 beds. So I had a class start 1 year. And then And then the next year, I got some grant funding from CHI Hospital as well as the American Heart Association. So we bought a lot of shovels and things that we knew would last, and we added on to the garden. So we have 12 beds now, and we even have a little PVC pipe soaker hose system in place so we can water the garden all at once. The class is for children's age 7 to 12. It's hands-on. When we get there, we go in the garden first because it's going to be hot later in the day. Cooking Matters comes, so they get to cook and eat. We always look at the garden. Most of it is planted before they come, but they do a lot of the planting themselves. This year, we were tasting some of the herbs, and I always like to ask the children, what does that remind you of? And so we were tasting oregano and basil and rosemary, and a little girl goes, it reminds me of pizza. So I always like to make them think about it. I don't tell them what they would find it in. I let them think about where do they recognize that from. That's us out in the garden a few weeks ago or early on. And we divide the whole group is from the Nothing But Net program in Omaha. It's a nonprofit. They do summer and after school programming. I tell them I only want 20 kids. Sometimes they bring 40. I'm like, ugh. So we deal with it though. We make it work. And sometimes the ages aren't in the range I want, but most of them are. So I have them divide up into 4 teams. I get volunteers from the UNO Service Learning Academy social work class. They have to put in hours at a nonprofit. So I have 3 people from there, and I have a coworker who my boss let help me with the program. They are the team leaders, and so each group has to name their own team. I say, I don't care what it is, has to be clean, has to be a fruit or a vegetable. So this year we have the Dragon Fruit Ninjas, the Peachalicious, the Silly Strawberries, and the Kiwi Killers. We've had the Mr. Potato Heads and the Sour Cherries. We've had all kinds of names. So the kids are excited. They each have their own garden bed. They planted beans this day, and they were putting their bean poles up. They all have a tomato. And they're also responsible for helping weed the gardens that are around their specific garden. And they got to make signs this year, and we laminated them and put them in the garden. This is them making their signs. And this is last week we made bee houses, so that was fun. So the big garden, which actually serves Nebraska, Kansas, and Iowa in putting out school gardens and community gardens, they assist us with a lot of the lessons for the garden. And we've done this enough so that I can do it without their help. So there's one of the signs. There's actually a joke on it on the other side. It's, what do frogs order at a restaurant? French flies. So it's a really fun group of kids, and actually last week we picked our first squash and zucchini, so we brought it inside, we cut it up, they all got to taste it. I brought Greek yogurt that day because I knew it'd be ready, and we went out and got a bunch of herbs to put in it to make our own little ranch dressing dip, and they loved it, and they really like tasting things. And one of our herb gardens has mint in it, and it kind of went crazy, and they're always wanting to grab it and taste the mint. A couple years ago, this happened. At 6 o'clock in the evening, another coworker took the picture. The deer ate our whole row of Swiss chard. And some of the kids in my class now have been in it a couple other times, and they remember that and talk about it. So we know the bad things for our garden are rabbits and deer, not just the other things. And here they are in Cooking Matters. And this was when they were weeding the garden or just looking for worms. I'm not really sure what they were doing. And that's one of the bean plants growing. So that program is kind of like my baby. We call it Thrive because we want our garden to thrive. We want our children to thrive. We want our community to thrive. Some of the kids that have come back report that, I always recognize them. I don't always remember their names right away, but some of them have been there since I started doing the program. And they talk about how they're doing their own gardening now. And they talk about how they try more foods now. So, the difference, even if it only hits a few households where they're able to know that they can grow their own food and eat it, that's exciting. And they're trying foods they've never tried. Our kale and our Swiss chard this year are going crazy. So we've been using the kale almost every week. And, they were not thrilled to try the green kale smoothies last week, but they liked them. So, let's see. I'm trying to think if I missed anything. I was trying to talk fast here. Basically, I think I'm in a really unique position. First of all, my boss and my administration support me doing these programs, and they kind of just let me have free reign about what I want to do. You know, I just say, hey, I'm going to do this now, and they're like, okay, you got the money. So as long as I'm seeing my patients and doing my reporting that I have to do as the dietitian at the health center, which I do, these programs are just a natural fit, you know. Like I talked about non-compliant, if a patient has a barrier, is it just the patient's problem? No, it's our problem too. And I feel like I'm responsible for helping them find a solution to that problem. And sometimes they don't open up right away. And sometimes, you know, they need transportation. So, you know, when we find that there's a need, we try to figure out how we can help those people in the community, whether it's language or behavior health. You know, a lot of them see behavior health. We serve so many languages at Charles Drew, and I think we're very fortunate, right, to be right in the middle of everything. You know, Charles Drew has been there since 1983. The community that goes there really trusts Charles Drew. It really truly is their patient-centered medical home, and so you know, we just want to continue growing and serving the needs of the community the best we can. Did I do it? All right. I told you I'd go fast.